Welcome. Welcome to 10 Things I Learnt About Men's Pelvic Floor. My name's Dr. Suzie. I acknowledge the traditional custodians of the lands of the Gadigal people, where I am in Bellevue Hill in New South Wales, Australia. I acknowledge them and their descendants and welcome you wherever you are, whether you're a nurse practitioner or an allied health practitioner or a GP, or any healthcare practitioner experiencing or peer reviewing this presentation. Thank you very much for taking the time for your continuing professional development. My intention is that you take away something new, hopefully 10 new things, but something that's new to you, and hopefully inspire you to take on what I call the biopsychosocial approach. In fact, what we would call the bio-neuromuscular skeletal psychosocial approach when it comes to men's sexual problems. If this is your first time experiencing Vital, a very special welcome as well. I hope that you're inspired by our team of educators and also how Australian telehealth innovations is able to give allied health practitioner programs like these that are bulk billed with no cost access to timetables of treatment rooms, just with a GP referral and a 5 EPC referral to our allied health practitioner. As a GP in this company, I always feel very privileged to be at electronic arm's length from allied health practitioners like Linda Manukian, our psychologist, or Harriet Scabaris, our dietitian, Nikita Dio, our diabetes educator, like Jenny Fernan and Ryan Samara, and all our nurse practitioners and health coaches. I especially feel very privileged to work in collaboration with these nurse practitioners who I feel provide this very critical link between these allied health practitioner programs and also our external referring GPs. They're what provide this medical oversight. They journey with the patient on the program, ensuring that the program for them is safe, and also prompt the reviews with the GPs. And so I really do love the fact that, when you refer into Vital, you're referring into this ready-made team, an interdisciplinary team of specialist allied health professionals. You don't need to go looking. They're right there and they're electronically available to you. So hopefully when you experience Vital, you'll experience this seamless new way of electronically coordinating and referring to programs like cardiac care or diabetes wellness or weight loss or pelvic floor or overcoming performance anxiety, so that you are being able to give your patients interdisciplinary care, structured programs, and get updated about their progress every 3 months with our prompting for chronic disease management reviews and opportunities for you to tap into case conferencing. Our desire really is to provide programs that plug into general practice, and hopefully you will be able to see that referring into programs like this is really putting chronic disease management in action for your patients, and hopefully you'll see the improved patient outcomes, and also that you can become more remunerated more fairly with the compliant use of these Medicare item numbers. There is hope for our Medicare system yet, I would say, but Medicare compliance and intelligent design using video telehealth and automation and case conferencing can in fact, really improve the quality of our patient care and also give better access. So for more details in particular about Vital, how these programs work, how to refer, about case conferencing or Medicare compliance, please go to our GP portal. You can see here, welcome to Vital Online. That's at learn.vital.com. That's learn.vital.com. And just click into the GP portal and you can experience the programs. You'll get access to Experience Now programs. You can click and watch what you're referring patients into with that timetable, but you can also see the various programs. It's an example of the cardiac care program here. You can see all our different programs and also from there be able to refer and register patients. Okay. So before I start, I just want to tell you how I ended up here and a little bit about my experience. So this is me, actually. I like this photo. It's me on my first day of Pump. Pump is our Kegels exercise room. This is one of our online treatment rooms. And this is me on my first day laughing with Catherine, our operations manager down the corner, on how on earth did I manage to end up here between the anus and the penis. And, it was a little bit of a journey. I got thrown into pelvic floor. It was a little bit of a journey in pelvic floor, but I certainly have learned a lot. I am a GP. I've got clinical practice of over 15 years. So I suppose that means that I've been used to knowing a little bit about everything and nothing about anything. But Dr. Sarah Melanson had written up a lot of information for us about men's Kegels and had written the pump program. So there was always a basic starting point. But I felt that my experience in this room and creating the pelvic floor program, I really brought to the table not just men's sexual dysfunction experience, but I'd been working alongside Dr. Sarah Melanson with sexology, building the Sex 101 course, watching and overseeing the RMBT program and the Overcoming Performance Anxiety program. So this space wasn't entirely not new to me. And I am actually quite used to traversing the unknown and frontiering in different spaces. I'd basically continued my professional development amongst a collection of other special skills. I'd built special skills training program that were GP Synergy accredited for GP registrars, including one for skin laser and cosmetics, as well as one for allergy and ENT. Not to mention, I was very much into women's sex problems. I'd had an interest in dyspareunia and atrophic vaginitis and libido over the years, specifically using the Mona Lisa laser. Really sparked my interest in women's sexology. But outside of that, I'd also had achieved instructor level for inner alchemy Qigong, been practicing Qigong for many years, and also trained in abdominal Chinette Sang, and had been fascinated by sexual reflexology and psychophysiology and the role of consciousness in medicine. So yes, I was kind of thrown into pelvic floor, into this program or building this program. But really, the building of this program, I see more as an integration of a lot of my general curiosities, as well as the integration of other special skills and interests. So I hope you find it interesting what I've learned on this journey. And so the 10 things that I've learned in this pelvic floor journey, and I've been in this space teaching pelvic floor for over 6 months now, is summarized in this one page. And so this is what I'm going to cover. These are the 10 things that I think that you would like to know that I've learnt along the way, in particular about pelvic floor for men as a non-drug tool for overcoming problems with ED, PE, and delayed ejaculation as well. And so at the top of this list is learning about being able to differentiate between organic and psychogenic sexual dysfunction problems. Really important, because since the advent of oral PD-5s, and I'll tell you what, oral PD-5s are a godsend, but they don't treat the entirety of a sexual problem. And quite often we may not be exploring if there is psychogenic causes and missing the opportunity to provide what should be first line, which is non-drug treatment. I think that I learned a lot about sex under the control of the autonomic nervous system. And so understanding this particular system, which is, limbic, it's generic, it's adaptive, but it can be maladaptive, it has reflexes, it's automatic. So learning about this particular system and how it is that men will need to be able to reprogram some of these reflexes or override these reflexes, I think are really important. My third thing that I want to share with you is this really important, or what was a game changer moment for me, was understanding that breathing affects your pelvic floor, and that doing pelvic floor programs like this was an opportunity for me to identify dysfunctional breathers, educate and intervene. Learning about the piston mechanism for breathing was a profound moment for me, and I'll share that with you. Essentially, I really want to instill with everyone this new kind of biopsychosocial approach when it comes to sexual problems, but also understanding that all these things are connected. We know sexual function and pelvic pain and even chronic prostatitis in men, they're all kind of connected. And I think understanding this new connected approach is absolutely critical for GPs. I also want to present a new idea or a new pandemic, and that's the pandemic of stress in the pelvis, and explore the science behind this idea of us holding stress or holding emotional tension inside the pelvic floor. And then we'll move into the troubleshooting moment, what it is that we need to explain to men to the first step to overcoming sexual problems is this idea that they've got to jump out of their head, because they're often in their head, and jump into body awareness. I'll be covering the Kegels exercise and why it does work, but also paradoxically it can make men's sexual dysfunction worse. And I'll be introducing you to my favorite step of teaching on pelvic floor, and that is the reverse Kegel. That is how to relax the pelvic floor. And this concept of that intentionally be able to relax the pelvic floor muscles during intimacy is actually the magic maneuver that men need to learn if they want to override that ejaculatory reflex and maintain erections longer. And to close, I'll be doing a 2-minute breathing meditation to try and get you into the process of experiencing how video telehealth works and how we run our programs. You'll be able to obviously do more of an experience of the pelvic floor RMBT with Harriet in our training as well. Okay, so let's get started. So one of the first things that I really want to impress upon any listening practitioners out there is this importance of differentiating sexual dysfunction issues into organic and psychogenic. So let me ask you this. On the last occasion that you gave out one of these little blue pills or a script for an oral PD5, how confident were you that you really differentiated their sexual problem was psychogenic or organic? Secondly, if you prescribed the oral PD5, did you follow it up? Do you routinely follow up the oral PD5 prescription? Do you confidently know if this medication worked? Did you pursue any other options? The reason I ask you to take this simple audit approach is that whilst oral PD5s are an absolute godsend, we would not be able to be, doing a lot of work in men's sexual dysfunction, achieving a lot of outcomes without it. It is a complete game changer. But like I said before, it's not completely treating the patient's entire problem. It's treating the patient's problem, particularly at the level of a blood vessel, but not certainly taking into consideration psychogenic causes. And while, yes, take this script and closing the case and closing the door is probably the most common approach to sexual problems, I do ask you to consider that the way you practice and to consider that neglecting to, ask these sexual questions or neglecting to explore the sexual history a little bit more to find out really what's going on is really the missed opportunity to provide them with the right type of treatment, because we know that psychogenic erectile dysfunction, acquired premature ejaculation, these may or may not, they're variable. They may respond to oral PD5s and they do have a place in their treatment. We do recommend that they're still initiated, but they need to be weaned and they need to be monitored. And a patient does need to be offered their first line treatment, which is really going to assist them more. And that is psychosexual education and counseling, sexology skills and training, overcoming performance anxiety with CBT and exposure therapies, pelvic floor, sensate focus. These are all the non-drug treatments that really should be offered to these men first. Now, admittedly, in the past, that's very hard to find. Where am I going to find a sex therapist? There's no one around here. But hopefully now you'll be able to see that, video telehealth programs like this have made it a lot easier for GPs to be able to refer in the appropriate patients that really need non-drug treatments first line. So if you want to kind of update in your mind a schema of how you see sexual dysfunction causes, you might want to update with a few new things. And historically, we've broadly divided these things into organic and psychogenic. So in ED, we've always recognize these organic causes, the endovascular causes, those patients with the cardiometabolic risk factors likely to have atherosclerosis, the neurogenic causes, the neurological causes. We know patients with MS or Parkinson's, or people who've had surgery in their spine, people who are substance abusers. There's lots of medications that can cause side effects. People have had pelvic surgery, in particular, if you've had prostate surgery. We know about endocrinological problems and Peyronie's disease. But you probably probably haven't included in this list pelvic floor dysfunction. And so I do ask you to update that mental list. And when it comes to psychogenic, one really needs to also consider the role of the nervous system. And if you're not familiar yet with things like polyvagal theory and how the nervous system relates to sex, we've got a lot more training on that, and it's a separate lecture all within itself. But certainly just want to, implant this idea that there is probably this list that we might have developed, or a schema that you might have developed. You may need to broaden it to at least include the pelvic floor. It's an extremely, extremely important part of men's sexual function that has been unfortunately quite neglected. And there are countless references to the role of pelvic floor in men's sexual dysfunction. It's certainly not new. I do rely upon two very stellar review papers that I will provide links to, that I do encourage you to read. And these were certainly desk side. These were desk side for me. One of them, you can't see what I just held up, but one of them was Pelvic Floor and Male Sexual Dysfunction, which was written by Italian androurologist and published in the Archivio Italiano di Urologica in 2013. And the other was The Role of Pelvic Floor Muscles in Male Sexual Dysfunction and Pelvic Pain, which was published in the Sexual Medicine Review in 2016. And given that the pelvic floor really supports the penis and our sexual organs, I think it's important that we give some attention to whether it is dysfunctional in some way. So in summary, don't underestimate psychogenic causes. Those partners will have feelings of stress or guilt or internal conflicts or self-esteem issues, depression, anxiety. Maybe there's trauma in the past. Maybe there's porn addiction at play. So don't underestimate the role of taking a key sexual history. You need to become adept at taking that key sexual history in order to differentiate. Common things that you should be making sure you don't forget is, checking about spontaneous morning erections or evening erections, because that can really be a great differentiator between organic and psychogenic. Finding out what their function was like with previous partners. It only obviously started with this partner, but they had previously normal sexual function. You've got to start thinking about this being acquired. What happened in that relationship? Was it a traumatic relationship? Quite often at the time of sexual dysfunction, there's a key stressor. Maybe they've had a major car accident and they were put on opiates for a chronic hip pain problem for 3 years afterwards, and that's when it all started. You need to start exploring when this occurred, what was happening around that time, and checking in about their sexual history, sexual abuse, or any abuse or trauma is really important for that matter. And we shouldn't be hesitant or reluctant to explore, how their feelings towards masturbation. Not everybody masturbates. Some people have sociocultural feelings towards it, or religious reasons that they don't masturbate. But asking about whether or not these problems occur with masturbation is important, and getting an idea of whether or not they're using any pornography. There is a lot of porn addiction out there, and porn addiction is associated with sexual problems, and that is a lecture all within itself that we'd love to spend more time on talking with people. What we should do now is just spend just a few moments just exploring a little bit more about how the pelvic floor is very important when it comes to men's sexual dysfunction. Like, what is its role? And let's start with erections. So firstly, when it comes to an erection, we've got to think about an erection not only in attaining that erection, but also in maintaining that erection, because erectile dysfunction is an inability in either attaining it or maintaining it. And when it comes to attaining it, the pelvic floor is really involved. And I often explain to patients, or a good analogy I use to explain to patients about the pelvic floor being involved in, the erection, is I just use the analogy of a blood pressure cuff. I always say, you've had your blood pressure taken before, there's a cuff and it's really tight, and you can feel the engorgement below, and it maintains that engorgement like a tourniquet. I said that's a little bit like your pelvic floor. And in the past, we would even referred to this process or these muscles as the erector penis. In fact, in Grey's Anatomy, the ischiocavernosus muscle was labeled the erector penis. And you can see here in red the ischiocavernosus muscle, and beside it there, I'll just put my laser pointer on, hopefully this works. So there's the ischiocavernosus muscle, and you can see the bulbospongiosus muscle surrounding the penis. Now, this is not the entirety of the pelvic floor. This is just superficial, but we know that these muscles are very important because when they constrict the base of the penis here, they prevent the blood flow. They constrict the corpus spongiosum. They prevent the blood flowing out. So they're facilitating an erection. And yes, these muscles can weaken with age. And that's why Kegels does improve the tone and stops those muscles from fatiguing. But it's an important mechanism, the pelvic floor, in getting in the erection and maintaining the erection. Very commonly, just improving the musculature around the penis through Kegels can assist with that. When it comes to ejaculation, we've got to remember, and we'll talk a little bit more about this physiology or this process of the ejaculatory reflex or this autonomic nervous system reflex, but there is a lot of tension that builds with the sexual arousal in the pelvic floor, and it's the sympathetic nervous system that activates this ejaculatory reflex. But unfortunately for many men, this ejaculatory reflex can misprogram. It programs or misfires a lot earlier. And so one of the mechanisms that has been reported to resolve this problem is to intentionally relax the pelvic floor, because by intentionally relaxing, in particular the ischiocavernosus and the bulbospongiosus muscle, you can provide this relaxation. The relaxation response can override this sympathetic nervous system reflex to ejaculate. So before we go any further, I'm going to move into the pelvic floor and define the pelvic floor a little bit more, because if you were anything like me, there's a good chance that you never really have thought too much about your pelvic floor. In fact, your first thoughts are probably much like mine, that really they're the muscles that stop your organs from falling out. And this is true. It is your floor, but I want to expand that the pelvic floor isn't just a set of muscles that are in isolation. Okay, I want to start helping you expand this idea of the pelvic floor being a little bit more connected. But the pelvic floor is this sort of hammock of muscles. There's 36 muscles. It's like a meshwork. There's 3 layers. And some of these skeletal muscles, about 20% of them are what we call fast twitch fibers. And when we teach Kegels, we explain the difference between the muscle fibers, some being fast twitch, some being slow twitch, and why different exercises are required to train these muscles. But about 20% fast twitch, 80% slow twitch skeletal fibers. And you can see that there's fascia and there are ligaments and there are blood vessels. Don't forget the importance. There are blood vessels leading down to the pelvic floor. These can be affected. There are veins, and there is neural tissue. And many of us forget the importance of neural tissue. We're focused a lot on the atherosclerosis or endovascular causes of erectile problems, but we very rarely think about the nervous system, and we very rarely think about the autonomic nervous system as well. But the pelvic floor is holding a lot of the organs. You can see here that, there's the rectum, you've got the bladder and the prostate, and these are all being held by the pelvic floor. And in fact, the pelvic floor has got openings, and you can see here the openings where the rectum passes out and openings for the urethra. So there are apertures. So the muscles are very important. The tone of those muscles, the movement of those muscles are what enables you to get the erection, what enables ejaculation, what enables the control of urination and defecation. Okay, so it is in control, and it's surrounded and connected to all of those organs. And its muscular activity is really important. Its muscular activity and the tension in the muscle is what will trigger that ejaculatory reflex. We'll often use the terms hypertonic or hypotonic, to describe the tone of the muscles of the pelvic floor. You might also hear me refer to it as the non-relaxing pelvic floor. For a hypertonic or a stiff pelvic floor, we'll often call it the non-relaxing pelvic floor. And this is the term that we use to describe this constantly turned on, activated set of stiff muscles. And I can assure you there are a lot of people walking around who do not know, particularly those who have sedentary occupations or have any chronic lower back pain or hip pathology, or frequently have behavioral issues like they've learned to hold on to their urine or hold on to defecation and not go when you need to. A lot of these people will often have non-relaxing pelvic floors, and a lot of people have non-relaxing pelvic floors as well, just from over-contracted abs, just from changing the dynamics of their pelvic floor too. But an important leap that you would have to make in this understanding of this muscle stiffness or muscle tension, or when there's a hypertonic or stiff muscle, the leap of how that affects the whole of the system is something that is new and novel, and it relies on this kind of endohumeral effect from the nervous system. We know that when they've looked into patients with chronic prostatitis and chronic pelvic pain from chronic prostatitis, many of these patients will have sexual dysfunction problems overlap, and many of these patients will have pelvic floors that are quite stiff. And one of the mechanisms that or the theories or the understandings of why these patients, why there's this crosstalk between the organs via the autonomic nervous system. And in particular, it's thought, or it's been shown, that a lot of these chronic prostatitis patients will often have this increased autonomic vascular tone, okay? And this increased autonomic vascular tone, it causes what they think is endothelial lineal dysfunction. And this dysfunction means that they're not producing, in particular, the nitric oxide, which is important for maintaining dilation, relaxation of the muscles and dilation of the arteries. And they also think that this is most likely the reason that causes this chronic muscular spasm and can contribute to affecting erections, because this elevated pelvic muscle tone is thought to impede the erectile function also by potentially obstructing the arterial inflow to the penis via an extrinsic muscle compression mechanism as well. So nerves, arteries, veins, they all travel together, but science is discovering now this very much more this fascinating crosstalk between the nervous system and the blood vessels, this neuroendohumeral crosstalk, in particular the role of nitric oxide in maintaining that smooth muscle relaxation, because we need to maintain smooth muscle relaxation for an erection. And a failure to maintain this smooth muscle relaxation, this increase in this autonomic vascular tone that they're starting to recognize, may well be something that you will understand and see a lot more in relation to erectile dysfunction. But that leads us to a little bit more of a discussion about the autonomic nervous system. And as I came into pelvic floor, I recognized and realized that I was going to need to know a little bit more about the autonomic nervous system. And honestly, I love learning about this nervous system. It's changed a lot since our textbooks. If you look at the first picture here, this is pretty much how I remember learning it in med school. I don't know if it was like you, but this is how I learned about the autonomic nervous system, that there was the central nervous system of the brain and the spinal cord, and it was broken up into these two systems, the parasympathetic and the sympathetic nervous system, the yin yang of these nervous systems. And this is how I learnt it, but I don't know if you'll notice yet, but when I learnt it with pictures like this, they often didn't even include the sexual organs. Okay, you can see here that it stops at the bladder. Okay, it was naughty, anything below there. And so I think that there was lots missing in our textbooks about how the autonomic nervous system relates to sex. So don't be upset if you hadn't given this much thought or know very much about it. I think that in the West, our understanding of the autonomic nervous system is evolving at lightning speed. It's evolving, but I dare say that it's probably only just catching up to maybe what the East has known for many more years. But I like this picture of the autonomic nervous system more because I like the way you can see these amazing nerve plexuses around these organs, and notice how they, correspond to those the yogic chakras. And I do think that there is going to be a storm in medicine as we really enter an age where we understand more about the bioenergy and magnetic fields that are associated with these plexuses. But I really am fascinated as well by the vagus nerve. And if you don't know much about the vagus nerve, I do encourage you to look into the vagus nerve. It is the largest cranial nerve of the body, cranial nerve 10, Viva Las Vegas. We now have polyvagal theory to catch up on. If you've never heard of polyvagal theory, I do urge you to look into it as well. It certainly covers this neuroception idea, this idea that the autonomic nervous system is perceiving or sensing threat, and we do that through emotions. What I really am fascinated the most about this particular vagus nerve, apart from the fact that it is, basically what's connecting all our organs to our brain, is that it is very much seeking information. It's 80% afferent and 20% efferent, 80% afferent. So it's really like the roots of a tree, seeking the information out. And I do think that, the autonomic nervous system, particularly with the sympathetic nervous system and this chain down here, the thoracolumbar chain, with all its ganglia, its readiness to act with, acetylcholine and adrenaline, and the second axis, the HPA axis, also working at the same time. This beautiful system. I think we don't in medicine, or in general practice in particular, we don't think enough about dysfunctions of this system. And many of us might have seen more POTS patients, particularly with long COVID or even COVID complications, and maybe starting to journey a little bit more into the space of autonomic nervous system dysfunction. But I urge you to really keep exploring there. And sex is, vaguely understood by doctors. I'll be honest with that. We know that there is a central nervous system role. There's a role more than we think, that is both from the brain, that's excitatory and inhibitory. It influences things just as much as what we think about atherosclerosis. So this is not just, so you need to open your mind and think about erectile dysfunction not just being about failing blood vessels because of atherosclerosis, which was kind of the way that I used to think about erectile dysfunction, but start to see that there is a larger picture at play. Now, this is my personal integrative mind map. Okay, so this is my mind map. This is not anyone else's, and it might confuse you. It might just amuse you. I don't really know, but I use this to help me understand. And if you remember nothing else, then I urge you to remember two things, and that is that the parasympathetic nervous system causes the penis to stand, or causes the erection, and the sympathetic nervous system is what causes the emission and the ejaculation. So if you remember nothing else, then those are the two roles, then that's fantastic. But the way that I like to sort of see it is that these nervous systems, these yin-yang nervous systems, are kind of like they're dials. They're dials, and they provide, there's baseline tones, and you can turn one up and you can turn one down. And when it comes to sex, there needs to be a fluidity between these nervous systems, because you need both. You need both parasympathetic and you need sympathetic nervous system. And a failure of that fluidity, if your gears are a little bit stuck or you're a little bit trigger happy, then you'll run into some problems. But this particular map is also a schema for me to integrate in there some of these ideas of polyvagal theorem, and these ideas that the emotions towards sex and your partner, those emotions are what establish the nervous system. They establish if you're in the parasympathetic nervous system, which is cruise control for better sex. They establish if you're in the sympathetic nervous system too much, your fight-flight system. They establish if you're, in freeze mode for sex, where your dorsal vagal nerve is kind of shut you down. And your perception, or what we call your neuroception, your perception of safety and threat, is what essentially drives these nervous systems. And this might be something that is a completely new concept to you. But in its simplicity, with absolute simplicity, when it comes to an erection or penile tumescence, essentially this is what we call a psychoneuroendocrine event, and peripherally it's a neurovascular tissue event. Okay, so you get this sexual arousal or sexual attraction. Mind you, erections can be spontaneous. We know that REM sleep is associated with spontaneous nocturnal erections, which is always a very good screening question, as I mentioned, between organic and psychogenic. But basically the erection is triggered by the parasympathetic division of the autonomic nervous system, and it causes the nitric oxide, or this vasodilator, to enable the trabeculae arteries to open up, that corpus spongiosum to open up full of blood, and there is the veno-occlusive effect on the vein to stop the blood from leaving, and so you are able to maintain the erection. The erection really is like a closed hydraulic system. It's a pressurized closed hydraulic system within the corpora cavernosa. And many men, you need to think about not just their ability to attain it, but also to maintain it. And to maintain it, very importantly, you need to have smooth muscle relaxation. Keep going. Okay, you need there to be smooth muscle relaxation. It cannot be underestimated, this fact. And if there is any endothelial dysfunction, if you don't have nitric oxide around, then you're going to get this stiffness and you're going to lose the erection. And smooth muscle relaxation is under the control of the parasympathetic nervous system. So you've got to start thinking about the sexual cycle, or sex, being under control of the autonomic system. You've got these kind of two dials going on, and sometimes if you're too dialed up on the sympathetic nervous system, then it's going to lead you to shoot quickly, to ejaculate quickly. But you do still need both systems, but you need to be able to move between these systems easily. When it comes to ejaculation, as I've mentioned, you need the sympathetic nervous system, and the sympathetic nervous system, when you're ejaculating, there is two components of that. There is emission and then there is ejaculation, and you very much need the contraction of the muscles of the pelvic floor to ejaculate. All right, so one of my biggest discoveries in this space was this relationship between breathing and dysfunctional breathing and the pelvic floor. The first observation I made was that most people don't really know much about diaphragms. And I say diaphragms because let me ask you this: how many diaphragms do you have? Most of us will always think about the thoracic diaphragm. We'll always think about the thoracic diaphragm, but moving with our breath, but we actually have more diaphragms, and the urogenital or pelvic floor is a diaphragm too, and it actually works with the thoracic diaphragm. And this is what people don't know. They don't know this thing called the piston mechanism of action of breathing. Your pelvic floor is not concrete. It actually can move. You can move it voluntarily, you can contract it right now and do a Kegels, but it actually is also moving involuntarily, okay? And that's what's creating this flexibility of your pelvic floor. One that's not stiff and stuck or hypertonic is one that's moving with your breath. And so what I want to do is have a little listen to this particular physio, who I think explains it very, very well, this idea of the pelvic piston action of breathing. So I'm going to press play first, and then we'll have a chat on listening to a physio explain this.
My name is Uma Ghosh, and I'm a registered physiotherapist. The way the pelvis works is that it does not work in isolation. It's actually working in conjunction with many other systems. The most important one being your diaphragm. The diaphragm is a muscle that is like a dome underneath the rib cage, and it is a mirror image of your pelvic floor. And we breathe 24,000 times a day. So 24,000 times a day, a whole mechanism is being dictated by the diaphragm. So we're taking a breath in, the diaphragm contracts and moves downwards, it compresses the abdominal contents, and that pressure descends down on the pelvic floor. Under normal circumstances, your pelvic floor is supposed to open into that pressure. pressure. And so there's this nice dynamic between diaphragm and pelvic floor working 24,000 times a day in what's called the pelvic piston. When you're someone who breathes with a slightly different pattern, meaning breathe more into the neck and shoulders, or if you're someone who's more of a belly breather and you breathe more into the abdomen, that's going to disrupt that whole dynamic or that relationship between the diaphragm and your pelvic floor. And oftentimes what ultimately happens is that the pressure ends up to be more so in the pelvis than what is considered to be normal or what the pelvic floor is designed to deal with. And this can create different issues with incontinence, with prolapse. It can also do the opposite and create a hypertonic pelvic floor and create issues with pelvic pain and constipation and IBS. So the pelvic piston is extremely important. It's a big factor that we do have to focus on trying to reestablish lifelong.
So I think that's just a very good general explanation that the thoracic diaphragm and the urogenital diaphragm or the pelvic floor are actually working together. And if you are not using your belly to breathe, and there are a lot of dysfunctional breathers who are just doing this upper chest breathing, then you're not moving your diaphragm. And if you're not moving your diaphragm, then you're going to have you're going to reduce the ability to move your pelvic floor, and you'll get a stiff up pelvic floor. This was a real light bulb moment for me because I'd come from a background of looking at dysfunctional breathing. I'd seen a lot of dysfunctional breathing in allergy and ENT. I'd seen a lot of dysfunctional breathing with our chronic asthmatics and people with chronic sinusitis and allergies, or those with obstructive sleep apnea, chronic stress states and anxiety. And this idea that, you know, the way that you're breathing affects the abdominal contents, the pressure in the abdomen, and the ability for the pelvic floor to move was completely new to me, and I think really important. When it comes to better breathing, we offer one of our drop-in group medical rooms is the Better Breathing Room, which is run with Dr. Lucy and Harriet Scaberis, and I really love this room. It's one of the treatment rooms that are available to all the patients. They can click and enter into this treatment room. It runs weekly, where Harriet really refocuses patients or retrains them on nasal breathing and also belly breathing. And that's in the RMBT room. She does this, but also in the Better Breathing rooms, which is available on our programs. My next discovery and a repeated observation I found in the program was this idea of men constantly complaining that during sexual intimacy, they were very much in their heads. And that one of the things that we were training them to do was to jump out of their heads and jump into their body, back into what's called body awareness. Because most men during intimacy, they're worrying, they're thinking, they're not actually in the moment in sensory focus at all. They're thinking, am I good enough? Is she going to like this? Is it going to work? What is she going to think? There are all these feelings of inadequacy and helplessness and hopelessness and shame and guilt that are starting to come up from this inner self-talk. They're generally not in the experience of the moment. They're not enjoying the sense of touch and smell and sight. Modern day psychology calls this mindfulness. And it was very apparent that men were not in mindfulness. Okay, they were just not there. They had very reduced body awareness, and they had very vague awareness of their breathing, and they were certainly had zero or very little pelvic awareness at all. So one of the troubleshooting, how we troubleshoot men, or how we explain what to do in the heat of the moment, is really we are teaching them to get back or ground them, you know, to ground them. And we're giving them tools for these grounding experiences, particularly body awareness. We're teaching them about pelvic awareness, and we're teaching them the breathing strategies of how to relax their internal state and also to relax their pelvic floor. And this brings me to this idea about stress in the pelvis. And a lot of people have stress in the pelvis, so much so that there's apparently another pandemic that we haven't spoken about, and that's the pandemic of stress in the pelvis. And the pandemic pelvis was a name of a talk I kind of nicked from Dr. Breanne Grogel, who's a pelvic health specialist. She gave a talk in March 2020. It was a really good pelvic floor event. And she certainly highlighted this idea that everyday stresses, anxieties, and fears are leading to this tightening of pelvic muscles. And often we don't know about it. Okay, that's the whole point. We don't even know about it. And this can result in this high tone pelvic floor or pelvic floor dysfunction. And that's why it was dubbed this term pandemic pelvis. So let's consider that for a moment, the possibility of holding stress in your pelvis. We know as in general practice, you might have seen patients holding stress in lots of different muscles. You might have seen them holding stress in their temporomandibular joint and getting associated pains and discomforts, maybe it's presenting as a dental pain or an ear pain, for example, or bruxism. We know that they can get tight necks and it can develop migraines or cervicogenic headaches. It's no different that muscles like the pelvic floor are, that could be causing tension, might be causing medical problems. So it is definitely very possible. And what ends up happening really is that there ends up being this kind of ongoing cycle that where these patients may have a chronically contracted tense pelvis, which upregulates the sympathetic nervous system. The sympathetic nervous system says, I'm stressed. And we know that the sympathetic nervous system, when it comes to sex, can cause you to lose the erection because you use erection. It can cause you to ejaculate quicker or even not ejaculate at all. And men will then start to stress and fear or avoid sex, and this narrative and this anxiety then feeds this perpetuating cycle. Okay, so there is this ongoing cycle of this stress in the pelvis. But one of the most interesting aspects that I discovered with this was this idea of the emotions of sex, or just emotions in general, being expressed in the pelvic floor, and that the pelvic floor was in fact an emotional organ. I'm very fond of Dr. Wise, Professor Anderson, very well-known urologists that had previously developed the Stanford protocol, particularly for chronic prostatitis and chronic pelvic pain. They've done a lot of work in this area, and they're certainly the innovators of that paradoxical relaxation approach, otherwise now known as the Wise-Anderson protocol. And that is that essentially accepting the tension first in order to relax it. It's this awareness, it's this insight. Accepting it will help you reduce it. But they also wrote about this idea of the pelvic floor and strong emotions of the pelvic floor tightening in response to the level or intensity of an emotion, even without the person's awareness. Okay, so you might not be aware that the pelvic floor is tightening, but perhaps going into a sexual encounter with, with someone that you have guilt or shame, or you're having some problems with, or have had previous problems, it might be, without you knowing it, causing a tightening of your pelvic floor. And this idea was validated, and Dr. Brianne Grogel quoted this particular study over here. Went back. This study over here, the study conclusions in the International Journal of Pelvic Floor Dysfunction. She quoted this particular study. This was done in women, where they basically measured with EMG studies the involuntary contractions of women with vaginismus to different emotion-evoking movies. Some might have been funny and some were obviously anxiety provoking, and they certainly discovered that the anxiety provoking movies were involuntarily and without the woman even knowing, causing the pelvic floor to contract. This is your base, and in Eastern philosophy or Eastern traditions, this is your base chakra, which is your stability chakra as well. So how emotions relate to the pelvic floor and how the physical tension can be triggered by psychological anxieties, knowing that now the pelvic floor dysfunction could be psychophysical, I think is a pretty powerful understanding, or new understanding, that a lot of us need to make. Okay, so what about Kegels? What about Kegels? Well, Kegels are definitely evidence-based. I mean, we've known for a very long time that they work. We've known for a very long time that, contraction of the ischiocavenosus muscle can hold the erection. That's why it was labeled the erector penis, and it simply enhances the rigidity by compressing the corpus spongiosum. We've known this for a very long time, but what the real objective of any type of pelvic floor exercise is is that you're raising awareness and proprioception of the muscle. It's about understanding what that muscle is doing in time and space. It's about creating that pelvic awareness, recorticalizing your pelvic floor. We call that pelvic awareness. That is really the main objective. It's not just about strength, actually. It's about creating that awareness of what that muscle is doing when it's contracted, and then feeling how that muscle can fully relax as well. If you want to check out our Kegels protocol, I'll leave a link for the 15-minute 3-set guided Kegel exercise that I do with our men. This is a protocol that enables them to run through 3 sets of short, slow twitch and fast twitch skeletal muscle Kegel exercises, as well as emphasis on the relaxation phase of the muscle. And the idea here is that they're going to gain more ability to discriminate between contraction and relaxation, and improving the muscle relaxation can help them normalize their muscle tone. But going back to the original question, which is, can Kegels make it worse? Well, yes, it can help, but yes, actually, paradoxically, you can actually make a lot of men's sexual dysfunction problems worse. And it wasn't long before I discovered men mentioning this to me, which forced me to kind of investigate this a little bit further. And this is where I really kind of came upon this non-relaxing pelvic floor concept. And I think it's widely unrecognized. And, you know, the Mayo Clinic wrote a concise review for clinicians called The Recognition and Management of the Non-Relaxing Pelvic Floor, but it was written entirely for women. And I think that, you know, it is under-recognized and understated that men can have tight and stiff, hypertonic, non-relaxing pelvic floor. These are the guys that have got their abs that are switched on. They're often overtraining at the gym, or like I said before, they might have surrounding back pathology, hip pathology. They might be holding onto their stools a lot. They might have sort of irritable type bowel symptoms. These non-relaxing pelvic floor, if you overtrain it by doing Kegels, it's like kind of like, you know, pumping an already contracted stiff muscle. It makes it more contracted and more stiff and more hypertonic and more in spasm. Cohen et al. In the Sexual Medicine Review 2016 paper titled The Role of Pelvic Floor Muscles in Male Sexual Function and Pelvic Pain refers to this process as abnormally high pelvic floor muscle tone, which consists of pelvic floor muscles that are contracting more often or more strongly than necessary, or that rest in a stage of higher than normal activity, obviously is a cause for erectile dysfunction. And they propose that one of the mechanisms of this is that the spasm of the pelvic floor muscle can be providing this extrinsic compression, restricting the lumen of the internal pudendal artery, thereby limiting inflow into the penis. I might add as well that there are most men's understanding of Kegels comes from social media. And I know, not from exercise physiologists or pelvic floor therapists, I might say, and that many are overtraining or doing it incorrectly. I've even seen apps for Kegels which focus entirely on just, you know, just on the strength fibers or fast twitch fiber activity of the pelvic floor, and don't mention anything about ensuring there's adequate relaxation. So unbeknownst to these consumers, they could get more ischiocavernosus muscle hypertonicity, which could actually subsequently stop them from, you know, filling the cavernosus with blood. So it could be making their symptoms worse. The idea of pelvic floor really is about neuromuscular re-education. Okay, it's really about this conscious retraining of muscle in its activation and deactivation. What does it feel like contracted? What does it feel like in a fully relaxed state? And because you can't see the pelvic floor, you can't see it. I don't know what that muscle is doing. Then you have to become intuitively, you have to go inward, you have to go in an interoception, you have to be able to try and internally feel it. And one of the best ways for men who don't know if they're even relaxing their pelvic floor is to get them to do what's called the reverse Kegel, which is the next thing that I want to talk about and draw attention to, and that is the reverse Kegel. And I spend a lot of time actually training men on not just the Kegel, but actually on the reverse Kegel. This is, if not the most important step men need to learn. Okay, so it's not just about getting strong pelvic floors, it's about getting pelvic floors that can relax. And the reverse Kegel teaches them to stretch. It's an internal stretch. And a lot of people actually struggle with this exercise. They really do. They don't know what a relaxed pelvis even feels like. They don't have a yardstick. And so learning how to do this reverse Kegel exercise is an entire step. We train them on how to do this by instilling in them this awareness of what it feels like contracted and what it feels like in relaxation in this kind of repetitive cycles is what enables them to get more pelvic aware. And this is important, particularly if we want to get them to perform the magic trick or the clever technique, which is intentional relaxation. Because remember, stretch activates the parasympathetic nervous system. Stretch receptors are activated in the parasympathetic nervous system. And so when you perform some form of a stretch, you can induce a state of calm. And so that brings us now to the secret. Okay, so this is the magic maneuver. This is the clever technique that they refer to in these papers. You know, this is the clever technique. If only they can just intentionally relax the bulbospongiosus and ischiocavernosus muscle, then they will be able to override premature ejaculation and likely hold their erection. And so it's not as easy as you think. I mean, if I said to you, well, just relax your pelvic floor right now, there's a very good chance you will say, I don't know what you're talking about. I don't know where you're talking about. I don't know what you want me to do. Okay. And so that's why building this 5-step program, layering it on, first teaching them how to contract the pelvic floor, then teaching them on the second step how to relax the pelvic floor. Then in the third step, we go into training them on what is pelvic breathing, how to breathe, how to use visualization to actually enter into this state. And then we teach them grounding strategies along with autogenics to keep them calm, cool, and collected, and to start teaching them the protocol of what to do. And essentially, it's really just flex the penis in order to relax your pelvic floor. That's pretty much the secret. And this is now to wrap up. This is the fun bit. So let's experience a little bit of pelvic breathing. So pelvic breathing is essentially what we are training our men to do. We are training our men to breathe, not just from the abdomen, but to breathe so they can involve their pelvic floor. And by doing so, learn to relax their pelvic floor very powerfully. And one of the ways that I train pelvic floor breathing is by teaching them various different visualization techniques. And when you breathe and you learn to breathe in these ways by using the diaphragms and activating your vagus nerve and activating your parasympathetic nervous system, we're giving these men some really good lifelong skills. Okay, we're giving them lifelong skills. This is all really about nervous system retraining, and the fastest way to recondition their nervous system is teaching them how to breathe properly. And we cover a lot of breathing, in particular in pelvic RMBT with Harriet, and you'll get a wonderful opportunity to join Harriet's class. There'll be an experience room available to you so you can experience for yourself what we do with men. Harriet is very special. She's a yoga instructor as well as a psychologist, and so she really integrates a lot into these treatment rooms, these RMBT treatment rooms. RMBT, if you haven't worked out, stands for relaxation, mindfulness, and breathing training. And so RMBT training and getting these guys to do it regularly, weekly, drop into these rooms weekly. They're available on our online treatment room timetables. So men on our program will obviously get a cycle of care or a structured program, but also have access to a timetable. And these timetables are where we have our shared medical appointments or our drop-in group medical appointments, which are nurse practitioner moderated. And these patients can, enter into these treatment rooms as much or as little as they want, but it certainly gives them a lot more access to our allied health professionals, a reach or a touch point with our nurse practitioners. And I think a lot of our patients find these rooms, like it's like a gym timetable, really valuable. Okay, so one of the activities, and to close on this session, I'd like to do one of the activities that I run with men, and this activity is one of my breathing activities. And what I tend to do is give them 3 different breathing tools. I'm going to give you one, and in this particular visualization tool, we're going to borrow from the yogis the base chakra Muladhara visualization of the 4-petal lotus flower. Okay, so we're going to use this visualization tool of the 4-petal lotus flower opening and blooming in the pelvis as a way for you to connect with the pelvic floor, because we know that the pelvic floor, you can't see it. How am I going to connect with it? Well, you have to use visualization. And so in this particular activity, we're going to do a 2-minute meditation, trying to tune into the pelvic floor by way of a visualization of this 4-petal lotus flower. But what I'm going to do, and hopefully this all works, I'm just going to press play first on just a clip that might help you with the visualization when we do the meditation. And in this clip, I'm just moving it. I hope this all works. We're going to, hopefully you're seeing that at the same time and there's not too much delay. Don't worry about the audio, but you can see here that this pelvic floor therapist has got a balloon, and the base of the balloon is the pelvic floor. And on there, you can see this flower blooming. And as you're breathing in and your belly expands softly, the pelvic floor is dropping down. And you can see that dropping down. But I want you to imagine that elasticity of the pelvic floor opening. And you can see this flower bud as well, blooming and opening with that inward breath. So we'll watch her do it again, that blooming and opening with the inward breath, the pelvic floor dropping down. And then as you breathe, as you're expiring or breathing out, the air's leaving you, that bud is retreating and that pelvic floor is moving back up again. All right, so let's have a little practice of a little meditation, and at the end, we'll check in on how you went. So get into a comfortable position. We like to do a lot of experience work with our patients. We use a lot of audiovisual material with our patients. This is how we roll. And in this particular meditation, which you can do lying down or seated, it runs for 2 minutes. We're going to practice breathing with the pelvis, trying to get into a relaxed state, but using specifically this visualization. Here we go. Let's practice pelvic breathing using the base chakra, the Muladhara. It's a 4-petal lotus. Imagine it blooming in your pelvis. So wherever you are, just get into a comfortable position. You can be laying down on your back or sitting in a chair. Just slow down your breathing. Breathe slowly through your nose and visualize drawing that air down deep into your lower belly, into your pelvis. Go beyond the navel. As you inhale, feel your belly softly expanding, and as you exhale slowly through the nose, allow your belly to recoil back into its resting position. You may like to place your hands below your navel, and when you breathe into your pelvis, I want you to imagine the blooming of a 4-petal lotus flower, opening from a bud. And then as you exhale, that bud closing with that breath out. You may want to imagine that mandala effect, especially this motion of bloom and then retreat with breath.
Rhythmically, that flower opening on inspiration and blooming, and then closing and retreating on exhalation back into a bud. With each breath, imagine that motion inside of your pelvis, rhythmically breathing in, lotus bud blooming, breathing out, retreating. And auto-generate this motion of elasticity, this opening with your breath in and closing with your breath out. And keep that rhythm and visualization going. And perceive pelvic breathing like a lotus budding. You should practice this until you can tune into this pelvic breathing more automatically.
Okay, so how did you go? That was just an example of an activity that we might do with a patient. But certainly from your perspective, whether or not you were able to connect with your pelvic floor and to sense that there was some movement of your pelvic floor through that visualization, I'm interested to know. There are actually other visualization tools that we demonstrate, and it's interesting to see that there's a fairly, it's a fair split amongst them, which one is more popular. I think they're all equally popular, but certainly the jellyfish breathing technique that we offer, as well as the balloon and the lungs breathing in the pelvis visualization, they're all very useful for some men to connect more with this idea that their pelvic floor is moving and you can get in contact with it. So I hope that this particular session has made you more curious about pelvic floor, has made you more curious about the type of video telehealth programs that are available at Vital. I thank you for listening, and please don't hesitate to check out what we have on offer at learn.vital.com. And by completing these experience reports, you'll be assisting us only make such an innovative telehealth company even better. Thank you again and have a great day.